So today we are going to talk about liver diseases, or we can tell that hepato diseases. So today we will discuss about hepato diseases, means liver diseases. Okay. So liver is an important organ in our body. Okay. So it is related to it is related liver is a largest organ in our body. Okay. First thing. And second is it is related to digestive system. Okay. So for digestive system, liver is an previous liver will play an important role for the digestion of fats, mostly by releasing bile. Okay. So and it is a factory. Okay. It is a factory where metabolism occurs. Metabolism occurs. This is very, very important. Means very any single thing, whatever we eat, first it will go to stomach, it will digest, and in the small intestine, okay, it will absorb. From here we have the arteries and veins directly to the liver. Okay, then the whole it will mix, the absorbed material will went to the liver, and what it will do, it will metabolize. What will it will do, it will metabolize means it will do the absorbed substances with the level of cell. Then it is easy to cell to absorb that material, whatever material it required, carbohydrates, protein, anything. Okay. It is the duty of liver to make the absorbed particles, okay, in the normal way to utilize by all the body. This is the function of liver with the help of other organs. Okay, this is very important thing. And after that, the waste products, whatever things like urea, nitrogenous waste, okay, all this will remove from the liver, okay, in a certain way. Okay, so there's the reason whenever a person is taking uh, any type of okay, any type of drugs, okay, so there's the reason the drugs will. So the metabolic waste or nitrogenous waste will remove by the liver in a certain. This is an important function. And another functions, it will store the vitamins. It will store the glucose in the form of glycogen. Okay, and whatever anti-toxic substance are there, what it will do, it will protect from that antitoxin substance. Okay, so these are the higher number of functions are doing by any liver. So there's the reason you can see in the tablet and the whatever drugs, or here drugs means medicine, antibiotics, painkillers. What they will write that it is it is injurious to liver. It will damage liver. Okay, so you have to careful while using the drugs. So these are the important functions. And another function is if this liver Okay. Okay. This is present in the uh, we have upper quadrant. Some part of it will come to the epigastric region. Okay. We will erase it. If you draw a midline, it is umbilical cord. Okay. You can see that the liver is coming from here. Okay. You can see this is the liver. Some part is coming to here. And you have some important another thing, that is gallbladder. It is attached to the liver. So liver is sending the bile juice to the gallbladder, and gallbladder stores the bile, will secrete to the small intestine. Okay. And it will digest the fat substance. Okay. Fat substances are digested by this bile juice. So what happen if you eat, if you are not eating on time, what will happen? This bile juice, this is in fluid form, gradually gallbladder what will do? It will concentrate, means it's improve the power of digestion. Okay. It's gallbladder what will do? It will improve the its function is to concentrate, to improve the more, the particular substance will increase and it will digest the fat easily. If you are not eating on time, what will happen? The gallbladder is storing bile juice. It is in fluid form. So there is no sensation. Gradually, what will happen? We have one hormone in the small intestine. It is released while you eating the food. The digestive particles are coming to small intestine. Then the hormone is released and it will give indication to the gallbladder to contract and relax. So when the contraction and relaxation happens, the bile juice come out of this and enter into the small intestine. But you are not eating on time, so then the hormone will not release. So gallbladder will not release the bile juice. When the bile juice is present in the gallbladder, it will become solid gradually. Sometimes small particles become solid type, that we will call gallbladder stone, GB stone. Okay. So this is very important thing we have to remember. So there are different types of diseases. Okay. Nowadays, liver failure is common, liver cirrhosis, cancer of liver is common, jaundice is one of the disease. Okay. Hepatitis, all these types of diseases. So we'll discuss. This is the beginning. This is a basic understanding about liver. Okay. So if the liver is good, body factory is good, body factory is good, so everyone will get what they want. If the liver is not good, the factory is not good, it will not produce the required amount of products, then the body will not work. Okay. So mainly the patient will feel weakness. Okay. And he doesn't have any strong, uh, whoever liver is strong, his muscles are strong, his tendons are strong, uh, his ability to work is strong. He will start the work uh, with uh, with a attitude, with a confidence. Whoever having level strong, his confidence level are higher, and every time he's ready to work. What type of thing you will give? Okay, for fighting anything, he will ready for working, for going outside. Okay, whoever liver is strong, he will not sit at one place. Okay, so for the beginning of the children, their liver are very strong. Okay, so like wind, they will go there and there. Okay, and uh, they will fight or fall or play anything, any will thing you do. So whose liver is weak means he is not confidential. First thing, there he doesn't have confidence. He doesn't want to work. He never do startup for anything. You have to force to do the things. Please do the thing. Please do those works, etc. etc. Okay. You need to beg that person. Okay. So very important, liver. Okay. If liver is strong, total body is strong. If liver is weak, whole body is weak. Okay. So let's start the disease which is common in the liver. That is, liver is known as hepato. In the medical field, what we will call hepato. They are the diseases like hepatomegaly, means the size of liver is increased. First thing. Second is hepatitis. Okay. Inflammation of liver. Okay. All this we can see. So let's talk about the main diseases we will see in that flow, that is hepatitis. Okay. That is hepatitis. Hepatitis, I already told, the inflammation of liver cells. Okay. It is due to three reasons are there. One is infection, due to infection. Okay. And the second one is due to degeneration. And third one is toxic. These are the very important toxic cause. Okay. Infection, degeneration, and toxic. These are the main three reasons. Due to that, liver cells, hepato cells are inflamed. Okay, understood. So let's see the infection first. Okay, infection. In the infection, we have viral infection. Due to viral infection, there is the hepatitis. Bacterial infection. They will have spirocattal infection. Okay, bacterial infection and protozoal infection. Most common is viral, bacterial, protozoal infection. They are the three commons. And the bacterial infection, in the viral infection, virus. What are the virus? We have infective hepatitis or yellow fever. Yellow fever, and we have infective already it was serum hepatitis. All these are viral infection. In the bacterial infection, we have septicemia, pyogenic abscess. All this will cause bacterial infection. The protozoal amoebic liver abscess, malaria, and kala azar. All these are like malaria, the protozoal infection. Okay, in that we have septicemia. Okay, so next is we have degenerative disease due to degeneration. What is the degeneration? The fatty liver. Due to the fatty liver, most of the cause of fatty liver. Okay, the cells leads to degenerate. That will cause hepatitis. And then we have toxic substance. The toxic substance like chloroform. Okay, chloroform, arsenic. Okay, gold, etc. will cause hepatitis. And the fourth cause also is have, that is metabolic cause. Metabolic. In the metabolic cause, diabetic mellitus, it is one of the cause. Okay. Infection, we have bacterial, viral, and protozoal degeneration due to the fatty liver. uh, And third, due to the toxins like chloroform, arsenic, gold, etc. And metabolic due to the diabetic mellitus. So these are the causes. Okay. So we have to see the what is the cause. Okay. But here the most common is that is hepatitis. That is due to the hepatitis is due to the viral infection. Viral infection. In that we have two hepatitis. That is hepatitis A and hepatitis B. So these are the two viruses. Okay, will transform to the body. Okay, and it will take place in the liver and start damaging the liver cell. It will not happen suddenly. It will take time. Gradually, it will happen. Okay, gradually happen. So through the fecal matter, through the stool, okay, this will come, and through the fecal contamination. Second is contamination of water. In the contamination of water, you can find out the hepatitis A, B virus. Okay. So these are the mode of transmission to the body from the outside environment to the liver. Okay. It will take 2 to 6 weeks to incubate. This is the incubation period of hepatitis A and B. Mostly this will see in 20 to 30 years of age group people. So mostly in village areas, urban areas, people are affected mostly. So there is a reason government is giving vaccination for hepatitis E, hepatitis B. Okay, and what how it will affect? I told you already that the liver cells will gradually destruct. Okay, not suddenly damage will happen. Gradually it will affect. If the immune system is good, then the virus will not attack. Okay, so gradually the destruction will happen. So what are the clinical features? It is very important. Clinical features or symptoms that it will told by the patient. What is loss of appetite? Patient doesn't have feeling to eat the food. His appetite is decreased and low grade fever. And third one is very important. N- If the patient is in, we have two phases. One is ectric phase, pre-ectric phase, and second one is post-ectric phase or ectric phase. It is 2 to 14 days. After 14 days, these symptoms will arise. Okay. Here in that, these are the pre-ectric phase symptoms: vomiting, nausea, and low-grade fever, like 100, sometimes 102 also. Okay, these are the pre-ectric phase, and discomfort in abdomen, Okay. And sometimes urine becomes pale in color. Okay. And you can feel pain in upper abdomen. Okay, already told discomfort in abdomen, upper abdomen. This is the post pre-ectic phase. If after ectic phase, what are the symptoms? These are the some highly, if the disease is prolonged and after 14 days, if not treated, you can, yeah, the patient will get jaundice. And the splenomegaly, spleen size also increase, and the weight loss started. Okay, so you have to check all this to the patient. Ask the history is very important. So if the patient have weight loss, okay, not having less appetites, and his stool becomes uh, dark or sometimes dark yellow in color. Okay, this will shows you the ectric phase. Here also we have fever, but not continuous, in on and off. And sometimes they have pale face due to the jaundice, pale color urine due to the jaundice, pale color stool due to the jaundice, rashes on skin. So you need to check the LFT if you see all the symptoms, and advise USG abdomen also. And you have to check the hepatitis A B infection. Okay, all this need to be checked. Okay, to treat the patient. What what are the to be checked? LFT, liver function test. In that, bilirubin bilirubin level is elevated mostly, and alkaline phosphate also increased. Okay, you can check in the LFT. So this is all about the hepatitis. So hepatitis the is also one of the most common disease due to the contaminated water, food, or fecal matter. And the most common is hepatitis A and B. Okay, virus infection. You have pre-enteric stage and post-enteric phase. You have loss of appetite, low-grade fever, vomiting, nausea. Okay, and post-enteric phase you have discomfort in abdomen, also urine pale, jaundice, splenomegaly, weight loss, pale face, pale urine, pale stool. All this you can see. If you can, you have to check the LFT levels in the bilirubin levels are increased. Okay, it means that you have any type of infection in the liver. So to check that hepatitis A B virus test, you need to do. If it is positive, then you have to treat the patient. It will take longer duration to treat the patient. Sometimes you need superior advice. So what are the treatment options we have? Okay, in that we have, first go with S5, Ver1, BE or G. First we will start with B. Second is C10, WE. Okay. Third option is we have S10, L1, WE. And fourth one is C15, Ver1, YE. And you need C17 rapid dose to remove all the toxins from the body. Okay, and you can add here S5A2 also here, and need to give compress, warm compress of S5, C5, A2, F2, WE. Okay, in D5, start with D5 only, two times. Okay, warm compress S5, C5, A2, F2, and W is needed. Okay, this is the initial treatment option. Then after that, how the results are there, you have to ask the patient according to the condition. We need to decrease or increase the medication. Okay, if the patient have fever, add F1, A3, YE, and D6. Rapid dose have to be given. Okay, jaundice. Here we will not talk about jaundice. Jaundice will talk separately. Here we are talking about hepatitis. So this is the treatment plan for hepatitis initially. Okay, then if it is recovered, that hope there are the many chances of recovery. With this treatment itself, sometimes the patient need much more remedies along with that. Okay, so this is all about in today's class about hepatitis. We discussed in detail. Okay, if anyone any doubts, kindly ask.